Hey, it's Dr. Greg with Align Wellness Center, and I wanted to spend a few minutes with you today to go over a case and an adjustment of a patient who had some numbness and tingling in your arm. So if that's you, stick around, watch this, see what we do and how we changed our patient's life. Let me introduce you to Allie. Hi, how's it going?
Pretty good, no complaints.
Awesome. Can you tell me what brought you into our office?
Well, I had a lot of numbness and tinglings, especially nighttime, that it will keep me awake.
And that was in your arms, right? Your hands?
Arms and hands, yes.
Okay, and how has that been going? Are you still having that?
It's getting, well, it's much, much better. I have to say, I can sleep through the night. I don't have any more headaches, which is wonderful.
Super, awesome. And has it been tough getting care here?
No, not at all.
So, was it okay for us to share an adjustment with you so that people can see what we do to help you?
Not a problem.
Fantastic. Let's go ahead and lay down on your back, and we'll get started on checking you. Okay. I'm going to go ahead and pull on your legs to see what's going on, and we're going to start right up at the top of your neck. Okay? For many of our patients who've had numbness and tingling in their hands and arms, there can be some compression on the nerves that are in the base of their neck. So when they wind up having that numbness and tingling, we've got to work on decompressing the nerves, and Allie was one of them. We did some decompression within her cervical spine to help reduce the pressure on those discs, nerves throughout the top of her upper back. Hold that there, as well as the adjustments that we're doing. How did the traction go, and was it painful at all?
In the beginning, yes.
Uh-huh.
Now I'm looking forward to it.
Straight up with this leg. I love to hear patients looking forward to their adjustments, not just because it helps them to feel better, which I think it has for you, but how has been getting through the day at work?
Oh, I can handle the stress much better now that I don't have to concentrate on the pain on my neck.
Hug yourself. And the work you do is on your feet, isn't it?
All day long.
It's pretty stressful.
Yes.
Yeah. Let's flip over onto your stomach. We're going to check on her hips and her pelvis because that's the base and foundation of how she stands up. Turn onto your side and face me over here, and making sure that she's got a good stable base is important for everything to stack up above it. Back onto your stomach. Straight up with this leg. Switch legs. Good. Bend this knee. Keep that there. Bend this knee. Keep that there. Very good. All right, I'm going to lift your head up, and I'm going to lift up your hips as well. We're going to work on restoring some of the curves or bends within her spine. You know, the spine is designed to have 3 movable curves. One in the lower back, one in the mid back, and one in the neck. And they're supposed to be the opposite of each other. When we wind up losing those curves, those nerves, the spinal cord gets stretched longer than it should, and it can make it reduce its function as well as have more pain, reduce how your organs work, as well as make numbness and tingling occur. And I think that was really the case for Allie. We've been working over the last several weeks, now that we've gotten her out of pain, on helping to restore her cervical curve, and she's doing some homework to help with that, and it's been making a world of difference, so that now instead of just managing pain, we're helping her to develop health. Because for most people, health, when you're in pain, there's no way to develop health. When you're in pain, we've just got to manage the crisis. Could you sit up for me? Let's do a great dismount. So how was that adjustment?
Great, as usual. Thank you so much.
Awesome, you're welcome. And what would you say to anyone who is thinking or wondering if chiropractic care and chiropractic care at Align Wellness Center might be for them?
Well, just come and talk to a doctor. That's the best way to do it, and not any doctor. Make sure it's Dr. Greg.
Thank you so much. Is it okay to share this with everyone everywhere?
Of course.
Awesome. I want to thank you, as well as I want to thank you for joining us. If you've got concerns about your health, particularly related to numbness and tingling in your hands, arms, or upper extremities, or even headaches, let's connect, find a time to talk, and see if there may be something naturally that can be done so that we don't have to go into injections, surgery, or medications to wind up managing things. Once again, I'm Dr. Greg Gerstin with Align Wellness Center, and thank you for letting me be a part of your health.